Hi friends, I am trying to give you some information about one of the commonest surgical emergencies or condition, which is called as gallbladder calculi, also called as cholelithiasis. When it is inflamed, it is also called as acute cholecystitis, and when the problem is in the body for a longer time, popularly also called as chronic cholecystitis. Now, presence of gallbladder stones or stones in the lumen of the gallbladder is called as cholelithiasis. We have tried and postulated, but we haven't really got to the bottom of the issue as to why we get gallbladder stones. There are a lot of postulated comorbidities like obesity and all, but they really don't substantiate anything. Now, you will get pain in abdomen of variable intensity. You will also get what popularly called is acidity or dyspepsia, which is a general feeling of discomfort in the upper abdomen, and depending on the severity of the attack, you may get vomiting, nausea, high-grade fever, etc., etc. If this patient is diabetic, then you may also get swinging temperature with pain which is relentless sometimes. So, in short, gallbladder stones have the potency to create a lot of symptoms and severe ones. A clinical suspicion of gallbladder stones should prompt a doctor to get a good ultrasound of the abdomen done. Earlier it was difficult, but ultrasound centers and doctors are now available. One of the center may just be near your place. So, clinching diagnosis of gallbladder stones or cholecystitis is by a good ultrasound abdomen. Once that is done, we need to prepare the patient for a surgery, because no matter what and how long you use, a medical treatment will be a temporary course. It will bring down the pain, fever and all the symptoms for a while, but with the potency that they may come back again. So a definitive treatment for gallbladder stones is always an operation. This is called as cholecystectomy. In the earlier era, and still in some patients, it is done in an open method, and most of the patients now undergo laparoscopic cholecystectomy, which is a minimally invasive surgery or buttonhole or keyhole surgery. 3 or 4 small incisions are made on the tummy. A camera is put inside which visualizes everything, the liver, the small intestine, everything, and then with certain assisted other instruments, a gallbladder is removed from the underneath of the liver, taking complete safety that the gallbladder, the cystic duct and the bile duct are intact. The cystic duct should be clipped and the bile duct should be safeguarded. With the expert hand and experience, this operation is actually a straightforward procedure. In our center, doesn't warrant more than 24 hours of hospitalization, and in next 48 hours, the patient actually goes back to a normal diet, and therefore early recovery and going back to your routine early is achieved. Any of you, any of your family, friends or anyone who has been suffering from this issue or is suspected to be, my request is don't delay the diagnosis. Thank you very much.